Today I'll be working with the Marquise probe. I will have my PPE on. My PPE consists of my glasses, mask, gloves, and gown. Patient will be having a bare babe holder and a patient glasses. I also have my mirror and some floss. The floss will be used to check for diastema or open contact. With the probe, there's three different sets of probe that we have. We have the Marquise probe is color banded at 3, 6, 9, and 12. The Naples probe it has millimeter marking at 3, 6, 9, and 12, and it's curved to measure furcation involvement. We have the UNC 12 probe marking in 1 millimeter increment. There's color band between 4 and 5, at 9 and 10, and this probe go up to 12 millimeter. The Marquise Pro, the Marquis, my Marquise probe is an assessment tool. This is used for subgingival. It is uh, it is a double-ended unpaired instrument. It is a flexible, simple shank and circular in cross section. It has a blunt and rod shape tip with no cutting edge. It is calibrated in millimeter and is used to determine the health of the periodontrum. It is measured the sulcus slash pocket depth, count widen of attachment, assess for bleeding, and is also used to measure oral lesions and is used to see the progress of periodontal treatment. While probing, I'll be measuring gingival recession. Gingival recession is the apical migration of the gingival margin, resulting in the exposure of the root. Recession is measured by using the probe. The probe measurement is taken from the CEJ to the gingival margin in millimeter. The deepest reading needs to be recorded. I'll also be checking for frenum, the maxillary and mandibular frenum gently going around the lip. I'll be checking for the widened attachment. It's measured by using the probe measurement from the gingival margins from to the gingival margin junction, and that is taken and subtracted from the probe depth. Less than 2 millimeter is considered inadequate. Also, I will be checking for mobility by using the N of 2 on instruments. Mobility is graded into 1, 2, and 3. Mobility number 1 is slightly mobile, less than 1 millimeter, and mobility 2 is more than 1 millimeter but less than 2 millimeter. Grade 3 is severe, and that is more than 2 millimeters, and you can push down the tooth and it will bounce back up. Vertical involvement, they call it. The Naples probe is used to determine the measurement of furcation. Furcation is graded into 4 classes. Furcation number 1, you can touch it and you can feel a little indent. Furcation class 2, you can go inside of the furcation but not too much in. Furcation number 3, you can go all the way in through the furcation. Furcation 4, you can go all the way in and you can also see it clinically. Furcation 3 and 4 can be viewed on the x-ray. And we have clinical attachment loss level. Clinical attachment level is there's 3 of them. There's normal, there's no clinical attachment calculator needed. You got recession, where you're adding to the probe depth, to the gingival margin level, and you have overgrowth. Overgrowth, you subtract the gingival margin level from the probing depth. As we probe, we use light bob and scroll in and out of the sockets. It's very important that we go real soft, even though this is Dexter. Still got to practice those strokes like it's an actual person.
Yeah, it's just go in and out. I'm getting one, all one on that lingual portion, the lingual mesial, and lingual buccal was all one, and the straight mesial, lingual was one too as well. And it's very important to curve that instrument when you get into the interproximal spaces to measure them. You would curve your instrument to get into that call. As you can see, I got all ones on those, on all the lingual portion of that tooth. Another thing to take into consideration while probing is positioning of you and the patient. Position the patient in semi-supine position when you are working on the mandibular, and position the patient in supine position when you're working on the maxillary. When positioning for the mandibular and maxillary anterior, you'll be at 12 o'clock. For mandibular posterior tooth surfaces away, I will be sitting at the 10 to 11 o'clock position, and mandibular tooth surfaces towards I will be sitting at the 8 or 9 position where I feel comfortable. For the maxillary tooth surfaces away, I will be sitting at the 10 to 11, and tooth surfaces towards I will be at the 8 or 9. Now I'm recording the probing depth for the facial of number 24. I'm getting, I would say all threes on those, and that when I got into the cult, it was a little bit deep on that distal end of that. Keep going. So with this one, I would say I got three for the distal. I would say three for the for the facial, and then three for the mesial as well. I would say while probing on Dexter today, I have most of the problems. His problems are involved around tooth number 14 when I was probing on the buccal aspect. There was forcation and there was bleeding on probe, as well as furcation.